Chiropractic care has long been the subject of studies that show it to be an effective treatment for chronic low back pain. However, few of these studies specifically focused on the comparison of chiropractic spinal manipulation treatment for the low back to epidural injections for disc herniation. How does a chiropractor use lumbar epidural steroid injections? Have you been advised to have lumbar epidural steroid injections, also called LESIs? Primary care providers, chiropractors, or other specialists may suggest these injections to ease back pain. When do chiropractors recommend lumbar epidural steroid injections? Have you been advised to have lumbar epidural steroid injections, also called LESIs? Primary care providers, chiropractors, or other specialists may suggest these injections to ease back pain. Let's break down the term lumbar, low back. Epidural, a rounded dura mater, the tough membrane that covers the brain and spinal cord. Steroid, cortisone, which has anti-inflammatory properties. Injection, introduced to the body with a needle. What does the research on LESIs say? You may have heard these injections called a shot in the back. Furthermore, you may wonder what they do. Would a chiropractor advise such a treatment? Let's look at some research. Increased fracture risk. A study published in the June 2013 issue of Journal of Bone and Joint Surgery states each successive injection increased the risk of fracture by a factor of 1.21. The findings suggest that LESIs may lead to increased bone fragility, suggesting that the use of LESIs should be approached cautiously in patients at risk for osteoporotic fractures. Chiropractors have known for a long time that steroids make the bones weaker. This research adds to our knowledge. As a result, you may want to consider safer options for a herniated or ruptured disc, sciatic nerve pain, low back pain, or spinal stenosis. Researchers conducted a study to compare the effectiveness of epidural injections to chiropractic care for the treatment of back pain associated with disc herniation. It found that chiropractic care was not only just as effective as epidural injections, but that it was also cheaper with a lower risk factor for troubling side effects. These results are good news for people who suffer from lumbar disc herniation, which causes chronic lower back pain. By choosing chiropractic care over epidural injections, patients with herniated discs saved on healthcare costs while reducing the pain they experience with the same level of efficacy. However, some are skeptical of these treatments due to their lack of foundation in placebo-controlled studies. For a highly expensive medication to be so widely used on a basis supported by little evidence, it's easy to draw cynical conclusions about the greed of traditional healthcare practices. Aside from this, many questions surrounded epidural steroids about whether the inclusion of expensive steroids in the solution has any advantage over painkillers alone. It is because steroids are proven to have side effects that include a weakening effect on muscles, weakening of bones in the spine near the affected nerve, and the creation of hormone imbalances in their natural production by the body. Furthermore, it remains unclear if epidural injections have any advantage over other more conservative approaches offered by conventional medical practices. The new study included 102 patients with confirmed disc herniation. While chiropractic care beat out epidural injections with a success rate of about 14% higher, this was deemed insignificant. Yet, where chiropractic care won out over epidural injections was at a patient cost, with a monthly rate of treatment at $558 versus $729. Temporary relief. According to the Cleveland Clinic Journal of Medicine, December 2004, while 50 to 75% of patients with leg pain received temporary relief after lumbar epidural steroid injections, only 25 to 57% received excellent long-term relief. Generally, patients who received little relief from their first injection received little benefit from a second or third injection. Also, the Archives of Physical Medicine and Rehabilitation, March 2004, says lumbar epidural steroid injections provide 32% of patients sustain relief. Chiropractors realize the limitations of lumbar epidural steroid injections. How do lumbar epidural steroid injections work? You probably have a lot of questions about the LESI injection. For example, do these shots heal a herniated disc, cure spinal stenosis, heal the sciatic nerve? It turns out lumbar epidural steroid injections don't do any of that. Instead, the shot dries up inflammation. Many people take steroids by mouth for the same reason, to reduce swelling. In the spine, you can think of inflammation as a watery fluid. You can't compress a liquid. So, when there is inflammation or fluid around tissues, the fluid causes increased pressure. When you put pressure on inflamed spinal tissues, pain results. To understand why lumbar epidural steroid injections fall short, consider these experiences. A patient has a herniated disc. Abnormal spinal biomechanics are part of the cause. What happens to this patient a few weeks after getting a shot? As you may have guessed, the pain returns. What about a patient with spinal stenosis? Sciatic nerve pain? A ruptured disc? The pain also returns. Why? The same stress that caused the problem reappears, so symptoms return. It doesn't fix the spinal biomechanics. Most studies show only short-term or partial relief with lumbar epidural steroid injections. When is an LESI usually recommended? Advice about lumbar epidural steroid injections varies with the specialist you visit. Your primary doctor, for instance, might give you medications. Anti-inflammatories, muscle relaxants, or pain pills are the usual options. What if the pills don't work? The doctor will then suggest an injection. Your spinal specialist or orthopedic doctor may urge you to try physical therapy and medications. They may propose an injection. If these efforts fail, your pain management doctor may suggest an injection right away. They may also advise another shot in 2 to 3 weeks. Keep in mind that the care described above does not correct biomechanics. These treatments tackle inflammation, but not the cause. Only a chiropractor can address the root cause of the inflammation. Chiropractors never recommend an injection as the only therapy. They know studies show a reduced long-term success rate with a shot alone. Instead, they treat spinal biomechanics at the same time for better results. How do chiropractors address spinal biomechanics? Chiropractic care differs from the standard medical model. First, a chiropractor thinks about what to avoid, such as long-term use of opioid prescription painkillers. While you may need meds for the short term, chiropractors discourage long-term use. These meds can be addictive. If you do not respond well to treatment, they may give you a shot of epidural steroid injections. Treatment then continues, which works better once the inflammation dries up. Shots alone, however, show only a 15% long-term success rate. It is why they don't begin treatment with an injection. Surgery. Chiropractors do all they can to avoid back surgery. People think it is a quick fix. That's not true, however. The British Medical Journal stated that people who had surgery and those who did not feel about the same after 1 and 2 years. Why go through the risks, downtime, and expensive surgery for the same results? Keeping these cautions in mind, chiropractors provide many other treatments. What treatments do chiropractors provide? A visit to a chiropractor is similar in many ways to see a medical doctor. First, you will provide a complete history. Next, you will get a